Fascist state ideology completely inverted the traditional Hippocratic Oath, transforming established medical professionals into active agents of systematic torture and extermination inside state-controlled concentration camps. Totalitarian regimes integrated elite academic universities, elite military research units, and private pharmaceutical corporations into a unified network dedicated to human exploitation without moral or legal constraints. The Schutzstaffel paramilitary organization directly managed the camp research facilities, providing human test subjects to state scientists, who treated prisoners as mere expandable biological raw material. Private chemical conglomerates collaborated closely with military offices, financing specific camp experiments to test proprietary pharmacological compounds on captive populations who could not refuse. In 1942, the German Air Force commissioned critical high-altitude survival simulations at Dachau to investigate pilot survival boundaries during high-altitude emergency aircraft ejections.
Victims locked inside mobile low-pressure chambers suffered acute atmospheric pressure drops, causing rapid cerebral gas embolisms, severe muscular convulsions, and massive internal hemorrhaging. Physicians continuously filmed the physical agony of subjects, documenting precise respiratory failure intervals to assist engineers in refining oxygen equipment for high-altitude fighter pilots. Severe cold exposure experiments at Dachau aimed to discover effective resuscitation techniques for military flight crews shot down over the freezing waters of the North Sea. Subjects were forced into insulated vats filled with melting ice water for hours, while electronic rectal probes continuously monitored the rapid decline of internal core temperatures. Alternative freezing trials forced naked prisoners to stand outdoors in sub-zero winter temperatures for entire nights, leaving frozen limbs unmedicated to document advanced frostbite progression.
Once internal body temperatures dropped below 30 degrees Celsius, researchers evaluated competing rewarming techniques, comparing rapid hot water immersion against intense localized electrical heat application. Over 1,000 healthy prisoners were intentionally infected with malaria mosquitoes at Dachau to test the absolute prevention capabilities of newly synthesized anti-malarial medications. Infected individuals received lethal experimental drug dosages, which induced acute kidney failure, toxic blindness, and severe nervous system destruction, rather than curing the primary parasitic disease. At the Ravensbrück concentration camp for women, surgeons simulated severe battlefield trauma on healthy individuals to analyze the efficacy of new sulfonamide antibiotics. Surgeons incised the lower limbs of subjects, deliberately introducing wood fragments, ground glass, and virulent bacteria to replicate deep, debris-filled battlefield combat wounds. The induced infections caused rapid gangrene and excruciating fatalities, proving that sulfonamides were entirely ineffective when applied to advanced, heavily contaminated projectile injuries.
Physicians also conducted invasive bone, muscle, and nerve transplantation experiments, removing entire structural tissue sections from healthy prisoners without providing any post-operative pain relief. In 1944, military researchers evaluated methods for making ocean water drinkable by isolating 90 prisoners into 4 distinct groups under strict starvation conditions. Subjects forced to consume chemically altered seawater suffered profound dehydration and severe convulsions within days, as their failing kidneys could no longer process the extreme salt concentrations. State authorities demanded the immediate development of rapid, inexpensive, and fully covert sterilization methods to permanently block the reproduction of target populations across occupied territories. Karl Klauberg injected caustic chemical formulations directly into the female reproductive tracts, inducing extreme local inflammation, intense scarring, and total fallopian tube occlusion.
Horst Schumann constructed specialized high-dose X-ray stations where prisoners were positioned between heavy radiation plates that inflicted severe abdominal skin burns and acute intestinal necrosis. Following radiation exposure, subjects underwent mandatory surgical removal of their reproductive organs so laboratory technicians could microscopically evaluate the precise cellular destruction achieved by the radiation. Joseph Mengele established an isolated research facility at Auschwitz to study genetic twins, aiming to uncover methods to double the reproductive rate of the preferred demographic group. Twins underwent exhaustive daily anthropometric measurements, detailed physical documentation, and painful eye examinations to isolate hereditary physiological anomalies from environmental influences. Mengele injected toxic liquid dyes directly into the eyes of living children to determine if iris coloration could be artificially modified to fit ideological physical ideals.
Researchers conducted deliberate cross-transfusions of incompatible blood types between twin pairs, observing the predictable systemic shock, high fevers, and acute renal failure that followed. If one twin succumbed to disease, Mengele ordered the immediate lethal injection of the surviving twin to facilitate simultaneous, side-by-side post-mortem anatomical dissections. At Buchenwald concentration camp, scientists established typhus research stations to evaluate experimental immunizations for military forces deployed in highly endemic combat zones. To test vaccine potency, researchers injected live typhus bacteria into hundreds of inmates, deliberately leaving a control group completely unprotected to record the absolute mortality rate. At Sachsenhausen, scientists exposed prisoners to liquid mustard gas and phosgene vapors to test chemical antidotes, resulting in severe chemical blindness and fatal pulmonary edema.
Physicians tested the lethal speeds of alternative toxic compounds by executing prisoners with poison-coated bullets, tracking the exact elapsed minutes until complete cardiovascular collapse occurred. Anatomist August Hirt collaborated directly with camp administrators to create a specialized Jewish skeleton collection at Strasbourg University to scientifically justify ideological racial taxonomy. 86 selected prisoners were measured, transported to Natzweiler-Struthof, killed in a dedicated gas chamber, and immediately sent to anatomy labs for soft tissue preservation. As Allied military forces advanced, camp physicians tried to obliterate all medical logs, dismantle specialized testing equipment, and execute surviving witnesses to conceal their crimes. Post-war investigations revealed that major pharmaceutical corporations paid flat daily rental rates per inmate to camp commanders, balancing clinical trial budgets against human life.
In 1946, the Nuremberg Medical Trial prosecuted 23 prominent doctors and administrative leaders, revealing institutional ethical decay across the entire national medical network. Accused physicians argued that wartime state necessity overrode individual rights, claiming their human experiments did not differ fundamentally from accepted contemporary international research practices. The International Military Tribunal rejected these defense claims, ruling that state authority can never legally bypass basic human rights or validate non-consensual medical intervention. The final judgment produced the Nuremberg Code, establishing voluntary, fully informed consent as the supreme, unalterable global prerequisite for all future scientific human research.